Hi, I'm Maya Bowers, doing an eyes, ears, nose, throat exam, scanning the room. Hi, my name is Maya Bowers. I'm going to be your APM for today. How are you?
I'm fine.
I am going to be performing an ears, eyes, nose, and throat exam on you today. Is that all right?
Mm-hmm.
Okay, perfect. The first thing I'm going to have you do is I am going to have you look at this eye chart for me, and I'm going to hold about 14 inches away from your face, and I'm going to have you just look at it and read me the lowest line you can read.
LTFPH.
Okay, perfect. I'm going to have you do the same thing, except this time I'm going to have you cover one of your eyes and read me the lowest line you can read.
LTFPH.
Perfect. And then I'm going to have you cover your other eye, and I'm going to have you read the lowest line you can read, but do it backwards this time.
HPFTL.
Okay, perfect. That is 20/20 vision in both eyes. Okay, so next I'm going to be checking your peripheral vision. So I am going to just have you stare at me, and I'm going to be putting my hands behind you and then wiggling my fingers up, and I want you to tell me when you can see my fingers in your view.
Now. 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 Now.
Okay, perfect. Now I am just going to have you put your glasses up, and I'm just going to look at your eyelids and your tear ducts, and I'm just looking for any redness. I'm looking for symmetry. I am looking at your tear ducts. Would it be okay if I touch your?
Mm-mm.
Does that hurt at all?
Mm-mm.
Have you had any watery eyes?
Mm-mm.
Okay, perfect. Now I'm just gonna have you. I'm gonna inspect the whites of your eyes, and I want you to look up and down and left and right while I hold your eyes open. Okay, up, down, left, right. Perfect. I'm seeing no lesions. They are symmetric. I am going to also next look at your corneas and your lenses by shining this light on the side of your eyes and just having you looking straight at me, okay? Okay, I'm seeing no opacities there. That is great. Next, I'm going to use my light, and I'm going to stand about 2 feet away from you, and I'm just going to be shining the light right at your eyes and looking for any, your cornea reflections. Okay, that's great. Now I'm going to use this, and I'm going to shine it in your eyes, and I'm looking at your pupils. Perfect. Your pupils are equal, round, reactive to light. Next, I am going to have you follow my finger with your eyes. And here I'm just checking the strength of your eyes, and your eyes are working well together there. Next, I am going to go ahead and have you look at me. I'm going to cover one of your eyes. I'm just looking for any eye deviation. So just stare right at me. Okay. Perfect. I'm seeing no deviations there. Your eyes are perfectly aligned. Next, I'm going to darken the room, and I'm going to look into your eyes with my ophthalmoscope. Okay, I'm grabbing my light here, and I am just going to stand about 15 inches or so away with my light, and I'm just going to look at the red reflex of your eyes. I'm going to place my hand on your head here. Perfect. I'm seeing that it's red. I'm just going to come in a little bit closer and look at your optic disc here. Perfect. It is round. It's pink. I'm seeing no hemorrhages. And then I'm going to look at your retinas. Your retinas are a normal orangish red color, and I'm seeing no hemorrhages there as well. I'm going to go ahead and look in your other eye. Again, staying about 15 inches or so away. I'm seeing that red reflex, so I'm going to come in a little bit closer here, looking at your optic disc. And it is looking round, distinct margins there, pink in color. And it is looking at your retinas, and I am seeing your retinas same as your other eye there, okay? Alright, next I'm going to turn the lights back on here. And I am just going to be looking at the outsides of your ears, just looking at the structures here, looking at your auricles, your tragus, your mastoid. Looking at your other side here, auricles, tragus, mastoid. I'm seeing no deformities, no lesions. Everything is looking intact. Next, I would like to look on the inside of your ears with my light here. Okay, I'm going to start with this side. I'm going to pull your ear up and back so I can get a good view of that canal there. It is looking free of wax. I'm seeing your tympanic membrane is pearly light gray color. No redness, no lesions in there. And look at your other side here. Your other side, no wax. I see your tympanic membrane, again, it's pearly grayish white. No exudate, no lesions in there. Okay. Next, I am going to use my tuning fork here. I'm going to place it on the middle of your head, and I just want you to tell me if you can hear it in both ears the same, or if one ear is feeling or hearing it better. So I'm going to take this and go ahead and equal. Okay, perfect. Now I'm going to use this tuning fork again, and I'm going to place it right behind your ear on your mastoid bone here. And I am going to tap it, and I want you to tell me when you stop hearing it. And then once you stop hearing it, I'm going to flip it around, and I want you to tell me when you stop hearing it once I flipped it around. Okay?
No. No.
Okay? On this side?
No. No.
Okay, perfect. Now I am just going to have you cover one ear with your... I'm going to have you cover one ear, and I'm just going to whisper something, and I want you to whisper it back to me. And close your eyes as well.
Driveway.
Okay, I'm going to have you cover the other side. We're going to do the same thing, and once you tell me the word back.
Pillow.
Okay, perfect. Now I am going to just have you look at me, and I'm just going to look at your nose for symmetry and any deformities, and I'm just looking for any lesions. Would it be okay if I touched?
Mm.
Is there any tenderness there at all?
No.
Touching your sinuses as well. Any tenderness there?
No.
Okay, great. Now I'm going to have you cover one side of your nostrils, and I want you to just give me a sniff. Okay, other side? Okay, would you say that's pretty equal?
Mm.
Yeah, okay, perfect. I am just going to look in your nose now. I'm switching the tip here. All right, would you go ahead and look up for me here? Okay. I'm seeing it's pink, intact, no lesions, no deformities. It's looking symmetrical. Perfect. Any pain in there?
No.
Okay. I'm just gonna have you look at me. I'm just looking at your lips. They're looking pink, moist, no cracking. So that is good. And then I'm gonna go ahead and look in your mouth with my light here. Grabbing a different tip. I'm going to use my tongue depressor here, and I'm just going to be looking all over your mouth. First, I'm looking at your mucous membranes. They're moist, pink, no lesions in there. I'm looking at your tonsils. They're symmetric. I'm seeing no exudate, no lesions, no swelling, no redness. Can I have you say ah? Great. I'm just looking at your soft and hard palates. Your uvula is midline. I'm seeing no lesions there as well. And I'm just going to look at the side of your tongue here. Good. I'm looking at the other side. I'm looking at your teeth and your gums. I'm seeing good dental hygiene here. Your gums are nice and free of swelling. They are intact. I'm seeing no exudate or edema. I am now just going to go ahead and feel some of your lymph nodes, and then I'm just going to name them out loud. Alright, so these are your preocular lymph nodes here, your postocular lymph nodes, your occipital lymph nodes, your tonsillar lymph nodes, your submandibular lymph nodes, your submental lymph nodes, your superficial cervical lymph nodes up here, your anterior cervical lymph nodes. I'm doing one at a time just because it's by your jugular here. I'm going to do your posterior cervical lymph nodes, your supraclavicular lymph nodes here, and then your infraclavicular. Any pain or tenderness with any of those? Okay, perfect. That concludes our ears, eyes, and nose exam today. Thank you.